Welcome to 4 Directions of Wellness. I'm Roberta Diswood. Tuabahanishle, Sisakani Bashichin, Nakaidenedische Hanahni Deshanele. Welcoming a new baby to the family is a joyful occasion, but it is also a time of transition and little sleep for parents and other family members. Newborns are going through a time of transition as well, moving from the cozy and contained environment of their mother's belly to the big, bright world. Everyone can feel overwhelmed. Here to talk about some techniques for soothing a crying baby, as well as ways to make sure parents and family members have support, is Dr. Jessie Kerr, a pediatrician at Northern Navajo Medical Center. She is joined by Teresa Pablo, a school health education coordinator with Teen Life. Teresa is holding her granddaughter and will add her wisdom about infant soothing and will be helping with demonstrations. Dr. Kerr, go ahead and tell us a little bit about yourself and why this topic is important.
I'm Dr. Kerr. I'm a pediatrician here, and I've been here for about 4 years, and I'm also the mother of 2 young children. So both as a pediatrician and as a mother, I've seen firsthand that infant crying can be stressful and exhausting. And so this topic is important because I think by teaching families and equipping them with a toolkit of soothing techniques, it can ease some of the stress that comes with crying because they can feel like they have something to do when babies are crying. And so if stress is eased in the family, that results in better outcomes for baby and parents and caregivers.
Thank you for being here. And Teresa, go ahead and tell us about yourself, and let's meet your grandbaby.
Okay, this is Layla, my granddaughter. She's 5 months old. And I'm Teresa Pablo, and I'm touching in Shlo to Haiklini Bashishi, now Bani Dashiche, Sana Bekle Dashanale. And I've been with Teen Life for 31 years, and I've worked with youth those years.
Thank you guys both for being here. And Dr. Kerr, why do babies cry?
So babies cry for a number of reasons. Babies could cry because they're hungry or tired, overstimulated, or if something is bothering them physically, like their tummy hurts or they need to burp. And so those are some of the more simple reasons they cry, and sometimes if parents are wondering why they're crying and they run through that list and see if they're hungry, see if they're tired, and one of those things is wrong, they can address it and the baby will stop crying. That's always nice. But another important thing is that sometimes babies cry when nothing is wrong. So it's a natural part of development to cry, especially in the first 3 months of life. And so some babies will have times of day where they cry more than other times. The evening is often a time babies cry, and that can be difficult because parents are tired too at that time. So if we learn some soothing techniques for when baby's crying and we've addressed all their immediate needs and they're still crying, these soothing techniques can work to help with some of that crying.
And so talking about that, what are what are 5 infant soothing techniques that you're going to review today?
So there are 5 techniques, the 5 S's. So they were coined by Dr. Harvey Karp from California. He's a pediatrician there. And I can demonstrate on our little rabbit here. So the first one is swaddling. So as you can see, I've swaddled up our rabbit. And I have its arms by the sides. That's because babies from the first 4 months of life or so have a reflex called the Moro Reflex. That's the startle reflex, where they shake their arms when they're put down quickly. Layla probably doesn't have that anymore. She's getting a little old for that. But that startle reflex can keep them awake. So by swaddling them, making them feel nice and tight and secure, you get rid of that startle reflex. And then putting them on their side can be helpful. So kind of like holding them in your arm on their side or like this. And that's because when they're put directly on their back, sometimes that makes the startle reflex go too. So on the side, so side lying, that's your second S. Your third S is going to be shushing. So shh, 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 or any noise like that. And that's because when they were in your belly, the baby had a large vessel passing by it, and it made a noise like shh, shh, shh all day long. And so when they're outside of you, they still find that noise and that constant like white noise very soothing. So doing that, any kind of repetitive noise can be very calming. So the third S is shushing. The fourth S is going to be swinging or swaying, so any kind of gentle motion, rocking motion while you're shushing, so you can shh and sway at the same time. And then the fifth and final S is sucking. So Some families find it helpful to give their baby a pacifier or a finger to suck, and that's fine. If the baby is exclusively breastfed, the recommendation is to wait on a pacifier for the first few weeks, just so there's no confusion with the breastfeeding and the pacifier. So to review, it's swaddling, side-lying, shushing, swaying or swinging, and sucking are the 5 S's.
So Dr. Kerr, those methods you talked about, what happens when baby goes to sleep?
Good question. So those methods are best for when you're soothing baby before they go to sleep. If they fall asleep in your arms, that's great. And if you want to then put them down in their safe sleep environment, it's just important to always put the baby down from the side-lying position you might have been soothing them in to sleep on their back in a crib or any safe environment free of blankets or other clutter that could get on top of their face or anything like that. So always on their back.
Okay. How about you, Teresa? What are some of the techniques that you use for soothing your grandbaby?
We do, when she gets fussy, we sing to her. And then sometimes I'll massage her feet. So she just likes that when I massage her feet. So I'll just do this and then she just seems to calm down. So, and then I'll do that on her fingers, on her hand too. And so she likes that. And then just rubbing her back. Maybe just put her down like this and then just rub her back. Just kind of massage her. So she does like to do that and just sway with her. And then the shushing, I do that a lot. And so making noise and just saying shh, 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 and then she calms down. And then when she doesn't calm down, that means she's hungry and she needs to see her mom.
So Teresa, I noticed that you brought in the Cradle Board today. Do you want to explain a little bit about it?
Yeah, that's Layla's security. She enjoys getting swaddled and wrapped, and then she naps in that. And then when we do wrap her, it's loose and it's the swaddle that keeps her snug and warm. The tie just kind of holds her in place.
So Dr. Kerr, why is it important that you tie the baby loose in the Cradle Board?
So you want to make sure that their hips can flex and extend normally, and that's to prevent hip dysplasia or any difficulties with the formation of the hip joint.
And so, Dr. Kerr, even with the knowledge of these soothing techniques, being a caregiver to a young infant can be very exhausting and stressful. What are some tips that you have of self-care for mom and even for dad or for the parents or other caretakers? What can they do?
Sure. So I think that's really important, self-care. One thing parents can do is know that if they ever need to put the baby down and walk away and take a breath, that is always fine. So as long as you're putting baby down in a safe environment or handing the baby to a caregiver and going outside to take a breath of fresh air just to relax and refocus, that is a very healthy and mature coping technique. And so that's not a failure as a parent to need to take a break. That is recognizing when you need to take a break. That's a good thing. And the alternative that we must avoid is, frustration and tension building up and, a parent or caregiver being harsh with the baby, overly harsh with the baby, and potentially injuring the baby or something. So taking a break, always important. I think another really important thing is just knowing that, to ask for your support system when you need it. So ask grandparents to help out, cousins, aunties, whatever it takes to kind of make sure that you're getting the help you need. Not be afraid to ask for help. And then, one thing I always say is crying is normal, and that we talked about these soothing techniques, but if you ever feel like your baby is crying too much and you don't know why, and it seems like it's beyond kind of what we've just talked about, or it's a different kind of crying, or your mommy sense is just saying, I don't think this is quite right, we're always available for parents at our pediatrician, in our pediatrics clinic here, and can answer questions, can check baby out, make sure there's nothing wrong, things like that. And then lastly, postpartum depression is a real thing. It's very common. And so if moms feel like what they're feeling is moving beyond kind of normal stress to having a lot of anxiety, to feeling really down or blue, or to having any feelings of wanting to hurt themselves or their baby. We have resources for postpartum depression, and we screen for postpartum depression in the pediatric clinic, the women's health clinic, our mental health clinic, or really any clinic in the hospital. They could seek help there to get more assistance, and don't be afraid or ashamed to ask for that help.
Well, it's really good to know and to be able to realize that it is just part of baby growing up.
Yep,
that
for
crying.
sure.
And Teresa, as a mother and a grandmother, what sort of advice do you have for new moms and grandmas?
I think it's just being patient, and I know that babies cry, and sometimes it is frustrating, but just being patient and then asking for help, taking a break. I think that's the most important thing, and then just being around supportive people and positive people. So,
well, I want to thank you guys both for being here. And I want to thank Layla for being here. This has been 4 Directions of Wellness. How going it?